Hey sonographers, Jessica here. Let's get into our cervical length, normal funneling, and our bulging membranes. So in the top here, I have a normal cervix, long and closed. As you can see, external os to the right of my screen. It'll say it right there. And then your internal os is towards where the baby is, basically, on the top part of the screen here. On the bottom, we have a short cervix, and I'll get into what that is on the bottom here, but a short cervix basically is 25 millimeters or less before 24 weeks, okay? So that is the gold standard measurement with transvaginal ultrasound before 24 weeks. I also will plug in the ASWAG, how to measure a cervix at the end of the video here. Here's another image of our endocervical canal, external os versus internal os. And basically what you see here is a measurement. Now I did want to get into when your cervix, when the view is kind of like curved, because you're not always going to have a beautiful straight cervix. With that situation, you should be measuring caliper to caliper, caliper to caliper. So just stacking calipers until you get that beautiful long cervical length. Here's an image of a nice, beautiful, straight cervix. You can see just you need only one caliper for this one. They're not always going to look like that, so but this is a nice, straightforward measurement here. Same thing here. Let's get into our funneling. So funneling, per the ASWAG, is identified as protrusion of amniotic membranes into the cervical canal. So on the top left, this is normal cervix, and once again, for measurements, you caliper, caliper to caliper to caliper. It's very hard because I'm not doing it live right now, but I'm pretty sure, once you get into, your clinicals or whatever, the sonographer or physician should teach you how to measure. But anyway, the top right is a Y funnel, the bottom left is a V funnel, and then the bottom right is a U funnel. So these are just the different kinds of funnels that you will see, and just help identify, to help show you that that this is a funnel. And we know this is a funnel and not bulging membranes because on the bottom, like towards the external os, there will be areas where the cervix is closed, right? So basically, your whole cervical length, top left, you got some amniotic membrane kind of coming in, and then you have closed. So that is the definition of a funnel. Here I just have an AI image of a regular cervix, top left here, which is long and closed, no funneling. Then in the middle we have a funnel, which is, V or U shaped, and the internal os open slightly. And then on the top right is the bulging membranes, which I will show some ultrasound images next slide. So next here is a image of bulging membranes, and that is when the amniotic sac is protruding through the cervix, okay? So here you can see basically the sac is going into the cervix, and at the bottom of the image here is a little bit of amniotic debris, which in sonography terms we call that sludge. So yeah, when you describe it to your doc, just, I can see remnants of sludge right here. Here's another image of a bulging membrane transabdominal. You can clearly see the baby's foot is down in that membrane. The preferred method is transvaginal, but you can also obtain transabdominal images, and this is a very good image of a transabdominal bulging membrane. Once again, this is an image of a bulging membrane, and the arrow is pointing to amniotic debris, which once again we call sludge. When you have a clear image of a bulging membrane, you definitely should have your physician in the room with you, or make sure you show them that this is exactly what you see. The bulging membrane image as well, basically there's no functional cervical length to measure, and that's how it's, that's why we say it's bulging, because you can clearly see that the membrane is coming out and there's no clear functional cervical length to measure. I would also put color Doppler on this sludge, and then usually that's a good indicator. I mean, you can see it, you'll see it floating around, but yeah. So that is a very good image of bulging membranes with sludge. So here's some info I pulled. Basically the screening guidelines are between 18 to 24 weeks, but I've worked in places where we started at 16 weeks, so it really depends what your MFM guidelines are, but usually 16 to 24, and then it just depends on the history and many factors. And then also here, the threshold for cervical length less than 25 is considered a short cervix, and this is before 24 weeks. Another measurement technique is your cervix should occupy 50 to 75% of the screen. We want to make sure that when we do our transvaginals, the mom's bladders are empty. We don't want a full bladder. We don't want any false positives. We want to make sure we got a beautiful image of, the cervical lens transvaginal post, after the mom goes to the bathroom. Once again, I'll plug in the website here. There's different websites to go on, but you want to make sure that you go on a reputable website. ASWOG, which is the International Society of Ultrasound, Obstetrics, and Gynecology, your AIUM, your SDMS, Society for Diagnostic Medical Sonographers. So yeah, just like if that's the case, just go on reputable sites. But yeah, all right, I hope somebody learned something from this. Please drop comments below, and we will move on to the next topic next week. All right, have a good one.